Welcome back to Indiana Physical Therapy, and here on Insight we want to talk to Ben and find out about knees, and you're seeing more and more people come in with knee problem that can lead to knee replacement.
Yep. Since early 2000, knee replacements have doubled in those over 45. Costs, and hospitalization costs are, nearly $30 billion per year.
Wow.
Yeah, lost job time, $3 to $12 billion per year. So it's a pretty big problem that people are having to deal with, and knee replacements are becoming more common as well as a means to deal with that.
Now we can start with the fact that you guys can help people who have gone through the knee replacement after the surgery, but there's ways to maybe prevent that, right?
Yep. There are things that they talk about as being non-modifiable, age, genetics. I mean, some of those things might lead to advanced degeneration of a knee sooner than later in some people. But there are some things that modifiable can help to ease some of those things in weight management, working on strength and range of motion. And physical therapy definitely can help in those sides of things to help with managing some of those symptoms.
And again, weight is obviously a big one. When you start and think about, just a couple pounds, walking around carrying that, how it just weighs you down. And then if it's, something you can't, it's really on your body, that weight just over and over on your knee, that's a big problem.
I mean, there is some debate in regards to whether or not, excessive weight can lead to advanced arthritis in a knee or osteoarthritis in a knee. But we do know that if a knee is aggravated, that it's going to hurt more if you have excessive weight, for sure. And it puts it like 4 to 5 times more weight through a knee for every extra pound that you carry. So for sure.
And the post-op side of that is something that I don't know that people necessarily look forward to.
It's not much fun, but definitely we as physical therapists can help lead you through that journey and figure out how to better manage those symptoms throughout that process as well.
Yeah. So do people, if they're contemplating knee replacement, need to set up that post-op with you guys ahead of time, I would think?
Based on their physician's orders, yeah. But sometimes what we'll do is we'll actually see people for a visit or two, or maybe like a month prior to, get them comfortable with physical therapy, work on some range of motion and strength, which will help them later after the surgery itself. And then maybe they can schedule appointments following that period of time then too, after they have their surgery.
That's interesting. I never thought about like pre-surgery physical therapy.
Kind of like we do with ACLs, we do that as well. They typically delay that for about a month to gain good range of motion and strength. We kind of do that with pre-surgery for knee replacements as well.
That's pretty interesting. All right, so if people, I guess, are living with pain in their knees right now, it's probably worth checking out with you guys first to see if it is something that can be treated through therapy. Yep,
I would always encourage somebody, if they have things that are common pain, stiffness, swelling, maybe get it looked at sooner than later. I'd rather see you sooner than the later part, and then be able to maybe manage it better, and then maybe even put off the other things later on, if need be. So.
Yeah, okay, so it's good to know. Again, for any sort of ailment that you want to connect with Indiana Physical Therapy, what is it, like 14 locations now? You guys keep expanding.
Exactly.
IndianaPT.com is the best way to get started, right?
Yep. On our website, you can find a location near you.
All right, IndianaPT.com. If you want more information, you can give them a call. We will be right back here on Insight.